Today, we're going to talk about one of the most fundamental skills in our clinical practice, assessing a patient's capacity to consent. This is one of those areas that really sits at the intersection of medicine, ethics, and the law. And getting it right is absolutely crucial, not just for our patient's safety, but for our own legal protection as well. So let's start with the basics. What do we actually mean when we say capacity? It's really important to be clear here. This is not about a patient's intelligence, and it's not about their diagnosis. It's a functional assessment. It's all about their ability, in that moment, to grasp the information you're giving them, think it through, and then tell you their choice. And while it's a clinical judgment that we make, it carries some serious legal weight, because valid consent can only come from a patient who has capacity. And this right here, this is the guiding principle for every single interaction we have. We always start from the assumption that our adult patients are capable of making their own decisions. It's only when we have a good reason to doubt this that we should even begin a formal assessment. The responsibility is on us to show that a patient lacks capacity, not on the patient to prove that they have it.
Okay, so what are those good reasons to doubt? What are the clinical triggers that should make you just pause and think to yourself, hang on, I need to formally assess this patient's capacity right now?
Well, here are some of the most common red flags. Obvious things like confusion or disorientation are a clear signal. Same goes for a patient who just can't seem to explain back to you what you've just discussed, or someone who keeps giving you inconsistent answers. A really big one to watch out for is when a patient refuses a treatment that seems clearly beneficial, but they can't give you a coherent reason why. The bottom line is this: if you have any doubt at all, you have to assess and you have to document it. So, let's say you've spotted one of those red flags. How do you actually do the assessment? Well, a really robust capacity assessment isn't just based on a gut feeling. It's a structured evaluation that looks at 4 distinct abilities. First up, understanding. It's pretty straightforward. Can the patient actually understand the information you're giving them? This means they need to get the basics of their condition, the treatment you're proposing, the big risks and benefits, and what the other options are, including, of course, the option of doing nothing at all. Second, can they retain that information? It's one thing to understand something for a quick second, but they need to be able to hold on to those key points long enough to actually think about them and make a considered choice. Third, and this is a big one, can the patient use that information to reason? This is all about their ability to weigh the options. Can they explain to you how they're balancing the pros and cons to get to their decision? And the key here is not whether we agree with their logic. It's about whether a logical process, one that's consistent with their own values, is actually happening. And finally, can they communicate their decision? The patient just has to be able to express their choice. It could be through speaking, writing, even gestures. The specific method doesn't really matter, as long as they can convey a clear and consistent decision. When you put those 4 abilities together, they give you a really practical, step-by-step process. So you start by providing clear information. Then you check their understanding and retention by asking them to repeat it back to you. After that, you dig into their reasoning, you confirm their decision is stable, and you figure out if they can communicate that choice. And finally, and this is crucial, you have to consider if there are any reversible factors that might be clouding their judgment. This is the kind of question we should be asking. It's simple, it's open-ended, and it gets right to the heart of the matter. Asking a patient to explain things back in their own words is so much more effective than just asking, "Do you understand?" It's a direct test of their comprehension and their ability to retain information. And that brings us to a really critical point. Capacity isn't a permanent state. It can change, it can fluctuate. A patient might lack capacity right now because of something reversible, like delirium from an infection, or maybe sedation from a medication, or even just severe pain. Our job is to try and identify and treat these factors whenever we can, and then reassess their capacity once things have improved. Now, once you've done your assessment, your work isn't over. The documentation is every bit as important as the assessment itself. Think of it as your professional and legal record of exactly what happened. It's your medico-legal shield. So, what does a good note look like? Well, it should be a clear, logical summary of what you found. Describe the patient's mental status. Write down the specific questions you asked to check their understanding and reasoning. Document their responses, and using their direct verbatim quotes is especially powerful here. Then, state your clinical judgment clearly and explain the basis for it, noting exactly what deficits you observed. And of course, always include the date, the time, and the specific decision you were assessing. Just look at the difference here. It's night and day, right?
The note on the left is just a subjective opinion, but the note on the right, that's a defensible, objective record. It provides the evidence, the why, behind the clinical conclusion. This is the standard we should all be aiming for in our practice.
So, what happens when you've done this thorough assessment and you come to the conclusion that the patient does, in fact, lack capacity for a particular decision? What do you do then?
Well, the path forward really depends on one thing: urgency. If it's a non-emergency situation, you should delay the procedure and get consent from a legal surrogate decision maker. But if you're in a life-threatening emergency where any delay could cause serious harm, you can and you should proceed under the principle of necessity. That's a legal protection that allows us to provide life-saving care. As we start to wrap up, let's just quickly review the most important principles that should guide your practice every day.
If you take away nothing else, please remember these 4 points. 1. Capacity is about function, not a diagnosis. 2. It's always specific to one decision at one point in time. 3. Always presume capacity until you have evidence that says otherwise. And 4. Your documentation is your best friend in any medical legal situation. So, I'll leave you with this question to reflect on. Think about the last few consent conversations you had. Was your process for assessing and documenting capacity clear, structured, and legally defensible? Making sure that the answer to that question is always yes is one of the best things you can do for your patients and for yourself.